Let's talk about a scenario, and I'm going to base this on a true story, but I'm changing the details to protect the privacy of the individuals. But let's talk about a story in which I was able to save my patient probably about $1,000, as well as reducing the barriers to my patient coming to therapy simply by understanding the timely filing limit for their insurance company, their out-of-pocket max, and the fact that their surgery is going to meet their out-of-pocket max, and waiting to submit their claims until all of the other medical expenses have processed. So here's the scenario. I'm going to lay it out. We had an individual. I'm going to say it's a young male individual, head of the family, 2 children at home. He was employed at a local manufacturing company. He sustained an injury outside of work, so it was not a workers' comp case, where he required a rotator cuff repair. Now, with his health insurance through his employer, he was going to have a $40 copay with every single physical therapy visit following the rotator cuff repair. He had a $5,000 out-of-pocket max, which means once he paid out-of-pocket up to $5,000, therapy would be covered at 100%. He had surgery. He had no real medical history. He's not the kind of person that was going to use up, medical benefits. So up to that point, at the time that he had his injury, he hadn't spent anything toward his insurance. But at the point of injury, he had an MRI. Then he had some follow-up care. Then he went in for a rotator cuff repair. So he had the hospital charges, the surgical center charges. He had the anesthesia charges, all of these charges. We knew that he was going to meet that $5,000 out-of-pocket max. We also knew that his particular insurance company had a 90-day timely filing limit, so we could hold claims up to 90 days from the date of service before we have to submit those claims for payment. And what ended up happening in this situation, he did not have any kind of short-term disability. He was not going to get paid while he was off of work. He wasn't able to go back to work for a minimum of 6 weeks, probably closer to 10 weeks. So if we were to submit claims as soon as we saw him, which we saw him within the first week post-op, none of the other medical charges had processed. So he would have been paying us the full allowed amount up to his deductible and then the $40 copay on every session, which would have put a financial burden on him because we would typically submit claims within 24 hours of the date of service. But seeing the big picture, understanding the whole scenario, what we did was we called and verified all of the coverage. We made a plan, an action plan to determine what is going to be the best option for this particular patient. We also knew that if he was to allow the hospital charges to process first and then make a single payment put on a credit card, the hospital would issue him, sorry, my dog's barking, a 40% discount, a prompt pay discount on what he was paying. So what we did, we went ahead and started seeing him within the first week post-op. We were delivering services. We were holding on to our claims. We would periodically, usually every 2 to 4 weeks, we would check his coverage. We would see as the claims were processing from all of the other healthcare providers. And then once everything had processed, the hospital reached out to him, said, "Dear Mr. Patient, if you can make the entire payment right now on a credit card, we'll give you a 40% discount." So whatever 40% of $5,000 is that's what he saved by paying all in one lump sum. We couldn't give him a 40% discount, but they could. We then submitted our claims after the other claims had submitted, but before the 90-day timely filing, and we were paid the full allowed amount by the insurance company, no out-of-pocket expense to the patient because his out-of-pocket max had been met. So I know there was a lot that what I said in there, and I know my dog was barking, which probably distracted you too. But understand, I am a huge advocate of sending claims lightning fast, within 24 hours, in the same day. But there's a time and a place, if you understand cash flow, if you understand how everything works, that holding claims, knowing that you're going to get the reimbursement at the right time, is an advantageous strategy, not just because it benefits you to allow the insurance company to pay you the full allowed amount, but it also could benefit your patient by allowing them to save money if the other providers are going to discount their services based on a prompt pay discount or payment at the time of service. So take these strategies into account. We're hitting into the new year. All the deductibles are going to be resetting. The better you understand the business behind, the finance behind the service you deliver, the more successful you're going to be, the better patient outcomes you're going to have, and the happier the patient experience will be. I hope that helped. I'll catch you guys on the next video.